Everyone, my name is Amna Dres. I am consultant optometrist and orthoptics. Today I will discuss about the presbyopia. In this topic we will cover what is presbyopia, what are the causes and symptoms of presbyopia and what is the treatment of presbyopia. First of all, I will discuss what is presbyopia. Presbyopia is a natural age-related condition that affects the ability of the eye to focus at the near object and continue to progress when they get older. Presbyopia may be occur due to the change in the lens and muscles of the eye, which are responsible for the focusing of the light onto the retina. Now we will discuss what are the causes of presbyopia. Causes of presbyopia are the thickening and hardening of the lens, weakness of the muscle, lens loss flexibility, and change in the accommodation. What is accommodation? Accommodation is the process by which eye adjusts the focus between distant and the near object. What are the symptoms of presbyopia? When patient come into the eye OPD, patient always complain of headache, nausea, tiredness, fatigue, and difficulty in near work. And what is the treatment of presbyopia? In presbyopic patient, we always advise the near edition glasses with the concern of age. It depend upon the age of the patient. Presbyopia may be developed in the emmetropic, myopic, and hypermetropic patient. In emmetropic patient, when no refractive error, presbyopia will be developed at the age of 40. In myopic patient, presbyopia will be developed late 50s, after 40 years. In hypermetropic patient, presbyopia will be developed before 40 years. If you have any query, then you can ask me in comment below the video. I hope you like my videos. Thank you and goodbye.